All right, well, I'll go ahead and get started. Welcome. Thank you, everyone who is joining us today. Just a brief, I'll let you know about kind of how the webinar is going to go today. It should run maybe just about an hour. Hopefully, we'll stick to an hour, and then we'll have some time for questions. Um, Currently, I think that most of you are muted. If you have a question that you want to ask, you can raise your hand, and I can unmute you, and you're welcome. Um, there's like a raise your hand button that you can press, and I'll unmute you, and you can ask your question. If you don't want to speak, you can also type a question. You can post a question, or you can just type it in the chat for the webinar, and I'll be able to answer your question. So please feel free throughout any time in the webinar to raise your hand or ask a question. That's one of the benefits of these webinars is that you all can kind of chime in, and I can provide further explanation that might be of particular interest to you. So let's go ahead and get started. So this is a webinar about the introduction to global aging data, and we're going to go over kind of an international set of studies that look at health and retirement and late life, and then look at a research tool that we built to help researchers utilize these surveys. So I'll get started by just going through the surveys if you're not familiar with these. Most people are familiar here in the US with the Health and Retirement Survey, which is run out of the University of Michigan. And this is a longitudinal survey that was started in 1992, and it surveys people every 2 years, people starting at the age of 51 and over. It surveys a representative in a household and their spouse, and it's nationally representative. And all of these surveys are national representative. Also, all of these surveys that I'm going to be talking about are at least partially funded by the National Institute of Health here in the US. And part of that in this public funding is that all of their data are available to freely use for research. So all of this data today is freely available for research. So the HRS started in 1992, and then starting in 2001, the Mexican Health and Aging Study was started, and they collected data in 2001 and 2003. They then had kind of a 10-year gap, and then they came back in 2012 for their third wave. A wave is just each set of interviews, longitudinal interviews. They had a third wave in 2012, and they're about to go into the field for their fourth wave. The English longitudinal study of aging. It's a nationally representative sample of people aged 50 and older in England, conducted since 2002. Adding to the list is a multi-country survey called SHARE, which is the survey of health, aging, and retirement in Europe. It includes over 20 European countries plus Israel, and it has 5 waves so far in existence, and it started since 2004. In every wave of SHARE, they've also added more countries. So SHARE has really continued to grow, and there's a lot of countries included inside of SHARE. The Korean longitudinal study of aging was the first Asian country to be added to these data sets, and that was started in Korea, and that started at age 45, so a little bit earlier and older in the Republic of Korea or South Korea, and that started in 2006. In 2007, and a survey which is actually a little started earlier, called the Indonesian Family Life Survey in Indonesia, was made comparable to this HRS set of surveys. Then in 2007 also, the Japanese study of aging and retirement started. The surveys Japanese people aged 50 and older. This is the one survey which is not nationally representative, although they do draw from different municipalities which are meant to cover different parts of the Japanese population. SAGE is a study which was started in 2007, and that's another multi-country survey, and it was started by the World Health Organization, and that includes China, Ghana, India, Mexico, Russia, and South Africa. So again, you get some nice variation. We see some African countries which are particularly interesting, and SAGE follows people aged 50 and older. TILDA is the Irish study, the Irish longitudinal study on aging. That's age 50 and over, started in 2010. Corellis is a Costa Rican survey, the Costa Rican Longevity and Healthy Aging Study. Its first cohort is people aged 60 and older, and that was in 2005 and 2007. And they then had a second cohort, which was interviewed in 2010 and 2012. And this second cohort is the cohort that's comparable to the HRS. Costa Rica also focused, this survey focused on the oldest of the old because there are quite a number of very old people in Costa Rica. Charles was added to this set of surveys in 2011. They had their first wave. They just released the data fairly recently for their second wave of data. These are people, national representative Chinese population, age 45 and older, and their spouses. The Charles sample is drawn from 150 counties in 28 of the Chinese provinces. It's a very large survey. And speaking of very large surveys, the last survey to kind of come online is the longitudinal aging study in India. It's drawn from its national representative of India, aged 45 and older, and their spouses. There was a pilot study which was conducted in 4 states in 2010. The national baseline is planned for early next year, and it represents it's national representative of India as a whole, and then also of each Indian state individually. And it's again a very big survey. So there's all these surveys which are comparable, and it's especially interesting to be able to compare retirement between these different countries. You know, if you have surveys which ask similar types of questions, you know, of someone who is in South Africa and someone, you know, who is in Japan, you can then compare, you know, what are some of the conditions of aging and longevity and retirement in these countries, and what are their effects on the population. So speaking of those common sets of questions, so here are the core content areas which are covered by these surveys. So these include questions about health, cognition batteries, diseases, questions about mental and emotional health, injury, physical functioning. All of these surveys include ADLs and IADLs, physical measures, and health behaviors, things like drinking and smoking, and preventative health measures also. They include healthcare utilization questions like whether someone has health insurance, whether that health insurance is private, it's provided by an employer, or it's provided by the government. This is something you see a lot of cross-country variation in. And then how much people spend on healthcare, both out-of-pocket and total expenditures. Because these are surveys which look at the retirement population, there are a lot of questions about your labor force status, so your employment history, usually you know, how long you worked, what kind of work that you did throughout your life, you know, what you currently, what you earned up into retirement, what were the characteristics of your work? Was it a physically demanding type of job? Was it more of a desk job? Disability, and then questions about when you went into retirement, and then what was your decision about retirement. And these surveys, because they focus on, you know, roughly ages 45 to end of life, kind of the idea is that you capture people pre-retirement, you watch them into their transition into retirement, and then to end of life. So this understanding the effect of retirement is extremely important for these surveys. All these surveys were designed partially by economists, and so they include a lot of economic variables. So these include income variables, wealth variables, for some of the surveys, consumption variables, especially somewhere like India, where consumption is probably a better indicator of what we would call income here in the US. Earnings, government transfers, this includes Social Security safety nets or disability transfers, housing, financial and non-financial assets. And these do change a little bit by country. So there is some survey variation because, of course, the kind of non-financial assets you would have here in the US might be different than what you would have in India. And then there's also a set of questions in these surveys which usually cover family structure, social network, family demographics, family exchange, how much time you spend with your family, whether you're married, the condition of your marriage, and social participation. How often do you attend religious events or community events, which can kind of give you an idea of how engaged someone is socially, which a lot of research has shown has a lot of influence on longevity and end-of-life conditions. There were a couple of key innovations, and I'll just briefly go through these to these surveys. One is they is an enhancing quality of economic data, and they did this by integrating unfolding bracket questions into the economic questions, and then they provided imputations for those, and we'll talk more about that. And they also integrated biomarkers, so real physical measures, blood measures, and genetic measures of individuals into a survey where we know a lot about their behavioral and their social conditions. So that's very interesting. So some of these physical measures are height, weight, blood pressure, grip strength, lung function, gait speed, and balance. These are things that are taken at the time of the interview. Some of the studies also collect types of blood. So whole blood is collected by Elsa in England, Tilda in Ireland, Charles in China, and Emas in Mexico. Dried spots are collected by the HRS in the US, by Lassie in India, by Germany for share, and in Indonesia for the IFLS. And a couple of the surveys are still thinking about whether to collect blood and how to collect that. And those include, so currently Korea, the other share countries other than Germany and Japan don't have blood collection. And then kind of one of the newest things that's happened is we have genetic data for 2 of the surveys, and that's for the HRS here in the US and ELSA in England. So in the US here they used a saliva sample and they used a whole blood sample in ELSA, and they provided a GWAS for both of them. So you're really able to kind of parse out what might be happening genetically once you know the conditions and some of the behaviors and choices of individuals' lives. So one of the things that we've done to help users understand kind of the vast set of questions which are comparable between different countries, but often a little bit different because of the conditions of that country or how the survey was designed or cultural differences, is we made a set of domain-specific user guides. So these are on specific topics, research topics, where you say you might want to look at cognition and understand how cognition is between different countries. And these are all freely available to download. I'll show you where to download them once we start to look at the site. And speaking of the site, so we're going to be talking mostly about the Gateway to Global Aging Data, which is a web resource tool that we have developed originally at the Rand Corporation and now at the University of Southern California. It's developed and maintained. And the Gateway to Global Aging Data includes a digital library of survey content, illustrative flowcharts showing skip patterns, a survey concordance with intelligent search to locate relevant survey items for your research. We've built in interactive graphs and charts. We include integration with Stata, the statistical analysis package, to match survey items to dataset variables. We also have built harmonized data files for cross-country analysis. These are really nice. These are very easy to use, user-friendly data sets so that you can compare, for instance, the ELSA data to the HRS data very easily, and the variables are named the same. And we'll talk a lot more about that. And recently, in the last year, we've added a searchable library of publications based on health and retirement surveys, so that if you want to look for, say, who else has looked at cognition between India and England, you can kind of quickly find papers that use that and start to build a basis for your own research. So quickly, I'm going to talk about the website. I'll bring it up right here. This is the Gateway to Global Aging Data. It's at the web address is g2aging.org. I'm going to kind of walk you through the tools that we've built on the Gateway to Global Aging Data. If you go to g2aging.org, you'll get kind of our face page, which looks like this. And then you can link to any of the main features here on the left, or you can just click on Home and kind of get to this this page that has a lot of branches off to different parts of it. So we're going to be going through lots of those. For those of you who just joined also, just to let you know you're welcome. Everyone is currently muted except for me, but you're welcome to raise your hand. And if I catch it and see it, I'll unmute you and you can ask me a question via voice, or you could just type a question into the chat or the question box. So let's talk about survey metadata and what we mean by that. So although we are kind of a repository for surveys, we are not a repository in general for survey microdata. So in general, we don't have data sets for you to download on our website. We include links to those survey data, and I'll show you how to actually download that actual data. But we offer survey metadata. So metadata is everything about the survey without the actual microdata, without the respondent level answers or the household level answers. So this includes the location of survey items inside of the interview. So for instance, a question like smoking, where was that asked inside of the interview? Survey question text, so how was the question phrased? Were there any interviewer prompts? Answer types and choices, where the answers, was it yes, no? Was it yes, maybe, and no? Things like that. How the question was asked and to whom. We also include links to the microdata variables and how those values are formatted. So we would let you know that, question 34 in the survey is stored as, Q34 underscore in the data set. So it's quite easy to make that linkage when you have the data downloaded already. We've also assigned research topics, keywords, and domains so that if you're searching for something, it makes our search a little more intelligent in case the question text doesn't have exactly the word that you're looking for. And suggested similar survey items, we also allow you as a user to make notes. So let's look at some survey data. So one of the easiest places to go here is surveys at a glance. This first tab here on our website. You can see on this first page, we kind of have a list here of all of the surveys which are included. These are in the columns. So the HRS here in the US all the way through LASI in India. And then we have years. And this chart is nice because it kind of lets you know, these surveys are referred to in waves, but the wave is specific to the survey, not to the year. So for instance, wave 10 of the HRS was conducted in 2010. While wave 1 of Charles was also conducted in 2010. So if you're wanting to compare similar years between different surveys, this can give you an idea of which waves you want to look at. I'll also briefly show you a little bit more about this tab. We also have a study overview tab, if you click over, which gives you kind of some of this brief information that I covered at the beginning. For instance, which countries are covered by which surveys, at what age someone became eligible for the survey. You see there's some difference there. Whether all people in the household were eligible or just one person, whether the spouse was included if age eligible or regardless if age eligibility. And then the method of surveying, the number of waves currently collected, and some other helpful information, including some numbers about how many people are currently included in the survey. So that can be helpful. But let's go back to this core interview. And so this is the link to all of the metadata here for the core interview. So let's just jump into one. Let's say we're interested in using SHARE, which is the Survey of Health, Aging, and Retirement in Europe. And let's go to SHARE Wave 2. So this is the 2006 SHARE survey. Surveys are generally broken into modules, and these modules have different topics generally. So you can see that SHARE started with 2 cover screen modules, one for the household, one for the respondent, then demographics, physical health, behavioral risk, cognitive function. Let's just jump into this behavioral risk module. And at this point, what we'll see next is we'll see all the questions that pertain to this module. You can see we have module items here. We have a couple identifiers which are included at the beginning of the module. These are identified by this icon which says ID. And then right below that we have questions. And these are identified by this icon that has a QU in it. So let's just look at this first question here, which is ever smoked daily. So if we click into this, we get kind of this is the base level for the survey metadata. So the question is ever smoked daily. We let you know that it's a question. The actual question text is the following questions are about smoking and drinking alcoholic beverages. Have you ever smoked cigarettes, cigars, cigarillos, or a pipe for a period of at least 1 year? The answer type is enumerated or choices. And the answer choices are yes or no, and those are coded in the shared data as 1 and a 5, and that can be helpful. We let you know that it's included in a harmonized data set that I mentioned earlier. This is the name of the associated variable. So this is the name of that variable in the shared data once you've downloaded it. You can locate it in a flowchart, which I'll show you shortly. We also have assigned topics here of smoking and tobacco. So, and this could be helpful, for instance, if you were using our search function and you wanted to search tobacco. So this question doesn't have the word tobacco in it, but it is essentially about tobacco use. So we've added some of these topics to help the search kind of work a little better. And then we've got concurrent items, and this is that same share question in differing waves of share. So you can link to this question in 2010 of share, 2012, or 2004. And then we've also got a bit of cart matching. So you can see researchers were also interested in self-rating reading skills who were looking at this question. So one way is if you know a survey, you can kind of walk through as we did here, and you can look at the survey piece by piece, kind of going, step down, step down, step down. Another way is just to use search. And we use survey concordance. That's what we call kind of our grand search tool. So users can identify comparable survey measures between all health and retirement surveys you can use a keyword search, top-level research domains, or finer research topics if you're searching for something in a harmonized data set. So this allows you to find comparable measures between multiple waves of one study or multiple studies, so something between two different studies. So let's go to this concordance tab, and this is our second tab here. So you can see here we've got a keyword search here. You would then select a study. You can select the years of interest, and then we've got some topics. And when I say top-level domains, these are these kind of broad topics here, a topic like demographics, family and social network, and then smaller subtopics which are available for harmonized data sets. So it's not the whole data set, but they're specifically designed data sets to be comparable, and those are available on this website free of charge, are here below. So let's just look for a couple examples. So say you were interested, let's say you were studying Chinese data, so you would want to use Charles. You can see that as soon as I click on Charles, I'm not able to select these years anymore. And we do that to kind of give you an idea of what's actually available. So you're not looking for Charles data in 1996 before Charles was started. So let's say we're looking for wave 1 of Charles here. And let's say I'm interested in looking at height. So we can use height and search. And you can see we get a bunch of questions here in our results quite quickly about height. And we could click in to any one of these. It looks like these are all from the biomarker module. This includes knee height. Looks like we got a couple questions here about height, and then I think whether someone didn't complete height, some other information like that. So you also notice that most of these, let's just click into this first one here, that most of these questions are in English. So all of these studies have been translated into English for this website, even though, for instance, Charles was conducted in Chinese. So you can see the question was, record the chair height from floor to seat in the space provided in centimeters, and they were given a range here of 0 to 999 centimeters. So let's go back to our concordance, and let's look for another example, and let's use these finer research topics for a harmonized example. So let's say we're interested in comparing between two surveys. Let's say England and a European country. So we'll look at share here. So the years that those two are comparable, we could look at 2004, 2006, or 2010. Let's look at 2006. And let's say we're looking at self-reported health status. So we can go down there and we can click search. And what you'll see is we're going to get variable names because we're looking at a harmonized data set here. So you can see we've got these variable names, which are for the harmonized ELSA and harmonized share, and they compare exactly self-report of health. Looks like we have two scales for both of the surveys, a European scale and an English scale. I have one question here from Chipan, which is just saying you have to leave in 5 minutes. I certainly understand. Yes, and they wanted to know if the slides will be shared. Yes, the slides will be shared right after this webinar. They'll be available on the download page. You can see download here, and you can see recent presentations. We'll put them up here, and we'll also put a copy of this video on YouTube, and we'll link to it also from here, so that if you wanted to, watch it later, or provide it to any colleagues or students, you could also do that. So let's jump back to our concordance now, and we'll look at one more example. So let's just say we're going to search. We'll use keyword search here. We'll search for health in general, and we'll look for that for share, and we'll look for that for the 2004 year of share. So we get a couple health in general questions here. Let's just jump into the first one, with is health in general version 1. So we jump into this metadata here, and I wanted to go to this. This is where I wanted to show flowchart. So it looks like we have 2 questions, so that's quite interesting. It also looks like, so we also let you know where it is, of course, inside of the survey. So it's share 2004 and in the physical health module. So looking at the whole module, you see we had this item view, which we've seen before. We also have a codebook view, which I'll just show you briefly. And if you're used to looking at sometimes how surveys are explained, this is kind of the view which is most frequently used traditionally. So this is kind of a view where you get the question text, and then skip patterns are really important inside of surveys, and so you see the skip patterns are indicated. So you have this kind of skip pattern here, which is if you have a random number 1, then you get asked this question, else you get asked this question, and then the number of pipes here on the right indicate how far into a skip pattern you are. But we wanted to give people a more visual way. Sometimes it's quite hard to follow complicated skip patterns in this linear fashion, and so we also designed flowcharts. So we can click on flowchart here, and you can see a visual representation of how the skip patterns work. And skip patterns are really important because skip patterns let you know how you have to adjust for when using your data. So for instance, often a skip pattern would indicate that someone wasn't asked a question, but they might not be asked a question because they've already answered that question previously, or because the answer to that question can be reasonably assumed based on previous questions. So that when you're actually analyzing the data itself, you really want to take into account the skip pattern, or else you have a lot of missings, which can actually be filled in. So let's look at this for instance here. So you can see we have this random number which is generated. I think it's a 1 or a 2. And if you get the answer 1, you get this first question, which how would you say your health is? Very good, good, fair, bad, and very bad. And this is the kind of the US based version of self-reported health. If you didn't get asked this question, you could ask the second version of self-reported health, and this is excellent, very good, good, fair, or poor. And this is a European or World Health Organization version of self-reported health scale. You'll notice that the US version is highly weighted towards feeling good. Like there's 3 levels of feeling good here. This is the second one here is the US one. So there's 3 levels of feeling good in the US version and only 2 levels of feeling good in the European version. And one of the things that Share wanted to do is they wanted to test how do these 2 compare to each other for people who are trying to do cross-country analysis. So that can be helpful. We can go through the rest of the survey and look down through the skip pattern. You can zoom out at any point. You can get kind of a larger view, and you can also print you can print out this entire flowchart. And if we go to the very end of this flowchart, we see that let's see, if your random number from the beginning of the module was a 2, then you get asked this other question, which is how would you say your health is? And you get asked the opposite. You get asked the opposite question that you were asked at the beginning for both groups of people. So this question was asked to each people, but for some people it was asked at the beginning of the module and some at the end. And this is another thing that Cher wanted to test, which is, what is the effect that being asked this question at the beginning of the module, a health module, versus the end of the module? What is the effect that that has? Because, for instance, you might come up to me and say, "How is your health?" And I might say, "I'm feeling fine today." But then if I go to my doctor says, "Well, have you been feeling tired? Have you had any falls in the last year? Do you have any aches and pains?" Often, and they do this for, say, half an hour. Then they say, how is your health in general? Often, a finding has been that people respond that their health is not quite as good as if you would have asked them at the beginning. So Cher wanted to test this effect. So I like this example because it's really nice to be able to tell the importance of understanding skip pattern. Because you might just go in and you might see there's 4 different questions about self-report of health, and there's 2 versions, and what does it mean? And so in this case, this flowchart really helps kind of visually explain what's going on. Here's one more example of a flowchart, and this is another common skip pattern that's used in smoking. And we'll use this skip pattern a couple more times in this webinar. So the first question is, ever smoked daily? Right? And so in this case, someone would say, yes, I've ever smoked daily, or no. And if they say yes, and they get asked this question, have you ever smoked? Do you smoke at the present time? But people who said they've never smoked aren't asked to smoke at the present time question. And so this is a skip pattern where if you were using this data, you would actually probably want to assign values based on the skip pattern, because Cher, and I think it's a reasonable assumption here, is assume that someone who has never smoked is not currently smoking. So they didn't ask that question to the user. And I'll quickly show you graphs and charts. So we wanted to build a way for users to really interact with the data before downloading the data themselves and applying things like survey weights and accounting for complex survey design, to give them a way for a certain select group of measures, which you can see here on the screen, give them a way to actually interact with the data themselves. So this is, let's see, this is our 3rd tab here, which is graphs and tables. If you click on this, you can see we have a chart here that just kind of pre-generates, and this is currently working for pay in the United States, China, England, and Japan for people aged 55 to 64 from 2010. So just looking at 2010 here. And you can see we've got notes here to let you know that everything is already weighted, as all these results are pre-weighted. So we kind of wanted to take some of the work out to, looking at some of the interesting cross-country variations that you can look at in these data sets. So for instance, this chart is somewhat interesting because people aged 55 to 64 in general are people you would consider could possibly be working in different countries. And you can see that, while just below 75% of Germany and Japan individuals aged 55 to 64 are still working, it's quite lower, 60, 61 and 62 for England and the US, and 56 in China. So there's some cross-country variation about when people stop working for pay at what age. Let's generate a few more charts. You can see you can select from countries here. So let's look at, let's compare the United States, England, Japan, and Italy. And we'll look at 2006. And these are the measures that you can currently kind of graph. Again, this is a really small set of measures from what is available, but these are the ones we allow you to kind of play around with to get an idea of the data. And let's take off this year restriction, and let's look at ever smoked. So we can click go. As soon as we click that, you get this chart up here. So you can see that we've got some really interesting cross-country variation here. So in England, 62% of the population of that survey, which again is 50 and over, said that they have ever smoked, comparable to 57% in the U.S., but much much higher than what we see in Japan and Italy. For any of these graphs, we also have tables. So if you wanted to look at this and have some more information like standard errors, that's provided here. All of the tables can also be downloaded in CSV or PDF format. just like the graphs here, you can also download in a number of different image formats. So this is interesting to me because this kind of defeats what I would think about smoking in Japan and Italy, where I think people smoke a lot, and I think that particularly in the U.S., people seem to be very anti-smoking nowadays. So let's look at a similar measure, which is smokes now. So not ever smoked, but smokes now. And so let's look at that. And what we see is kind of a reverse trend, right? So in Italy and Japan, they have 17 to 19% of people in these age of the surveys currently smoke, while it's much less. It's right at 15 or below 15% for England, the U.S., which is interesting, right? So to me, that would kind of imply that although in the past people in England smoked more than Japan, Japanese people are smoking more often now than in England. If we look at one country, so let's just look at England in 2006, we can also compare across different subpopulations. So we could see if this is kind of a gendered effect. So we could look over gender. For smokes now, it looks like we really kind of see very similar results of males and females, almost exactly the same currently smoking. If we looked at ever smoked by gender, so there we actually do see a kind of a gender difference between males and females. So 70% of males in the L subpopulation said that they have ever smoked, compared to 55% of females. And we can also look across age. So we have a couple age categories you could look over. So let's look at smokes now in age categories and see if this is changing. So this is, again, this is somewhat interesting. So we can see that people aged 55 to 64 and also 18% of them say that they currently smoke, but by age 75 to 84, 10% of them do. So there's some kind of stuff that's happening over years there, which is interesting. We'll look at a couple more graphs, which has already been generated. This is that first chart that preloaded that we looked at, but we've added a couple countries which are really on the extremes. I've added Slovenia and Sweden, and you can see Slovenia has below 25% of people currently working for pay, age 55 to 64, compared to Sweden where it's over 75. So you can get a lot of interesting cross-country variation, and Slovenia and Sweden are both part of SHARE, so they're asked exactly the same question. So you can reasonably assume that we're measuring exactly the same thing there, which is saying this extreme variation. If you're graphing, we also allow you to graph a number of income measures. We have financial and housing wealth measures and income measures. So these are financial measures. So this is total income, family income for England in 2004, and we look over 3 different age groups, just like we did there for that last smoking example. And so you can see the distribution of income really changes by age groups, which you would expect as people moved into retirement. And lastly, we'll look at something that kind of utilizes how longitudinal these data are. So this is the net value of primary residence in the United States, and we look over the years 2000 to 2010. So you can see, looking at both the median and the mean here, that people's housing wealth really continued to increase it increased considerably 2002, 2004, 2006. In 2008, it seemed like it kind of stayed very close to 2006 levels. It didn't increase, and then by 2010, it was really at levels that were pre-2004, and people lost it. Especially some elderly, and in the U.S., people hold a lot of their wealth in their housing, that they lost a lot of money. You'll also see at the 25 percentile, it's 0 here, and that's because a lot of people's their mortgages went underwater, so they actually have a negative value of housing wealth because they owe more on their house than it was worth, because the housing market was very depreciated. And so there's actually been some interesting analysis using HRS data at looking at a considerable number of these people who just lost a substantial amount of their wealth, which was in housing wealth, because of the Great Recession here in the U.S. So everything that we've talked about so far doesn't require you to be a registered user, and then everything that we talk about post post this and for the rest of this webinar does require you to be a registered user. So let's just talk about registration. It's very simple. So to register, you can just click up here at the top of it if you haven't already registered. I definitely encourage you to register. It makes it allows you to download any of the data or the programs we have available on the website, and it also allows you to have a profile where you store similar survey items which are helpful to you. So you just have to fill out a couple things, your name, your the country, what institution you're affiliated with, and make a password. And you'll get an email to confirm, and as soon as you confirm, you'll have access to it. So I'm gonna log in quickly here with a guest, an account we use for these webinars. Her name is Jane. So this is Jane's profile. So one of the things that having a registered profile allows you to do is to integrate with Stata. So the idea of integrating with Stata is that we can allow you to match those survey items that you're searching for on the gateway to the microdata sets that you have stored on your computer. So for instance, if you have the HRS data stored on your computer and then you find HRS questions on the gateway, which are relevant to your research, we'll then give you a Stata program, like a pre-generated, pre-written Stata program specific to you to produce a Stata data set with just those variables of interest to your research. So you do this through the data options page. So the data options page is right here. You can see we have this. Now that I'm logged in, I have this indicator which is saying your cart is empty. So let's go to data options. You can see that we can indicate data folder locations. And the reason to indicate where the data is stored on your computer is that every Stata program that we write for you, that the gateway writes for you, can contain the location of the data. So you don't have to go in and fill in your folder locations. So let's say that I have some data here. Let's say I have ELSA 2006 data. I just haven't listed it here. So I can say, oh yeah, this is stored in a folder called ELSA and a folder called 2006. And I can add this data set location. Let's say you don't have some data yet and you're interested in using a survey. That would be, you could go to the Downloads tab here. So on our Downloads tab here, which is our fourth tab, we have links to download survey data. So we will give you the link to any of the services to download the survey data for yourself. Again, as I mentioned, these are all publicly funded. So all of this data is available to download for free for research purposes. In general, you have to go through a registration process, a little similar to our site, and then get approved. You have to say you're not using the data for commercial purposes, and then your data is available. The one exception to this is LASI data, so the data from India, which you can actually download from the website here yourself, and you don't have to re-register once you're registered for the gateway, and that's because we're one of the organizing partners for that study in India. You can also download the harmonized data set, and I'm going to talk about that in just a few minutes. That'll be kind of our final topic. And then we also provide Stata programs for the harmonized data sets as well as codebooks for them. And then a couple other things below. So we have those working papers, which I mentioned earlier. So these are on specific topics. You can download any of those working papers here, as well as any other helpful documents. And this is where you'll find the recent presentations, including this presentation shortly. So let's look at one of the other features of being a registered user is that you can create analysis data. So you can create a collection of survey items which are specific, to a particular research topic or analysis, and you use it using an item cart. So you can search for relevant survey items. You can browse for surveys by relevant survey items. You can browse by topic, which we've looked at, or you can use something called predefined carts, and I'll show you what that is. So let's just look at an example. So let's say we want to compare whether health limits any paid work in 2006 between the US and England. So what we're going to do is we're going to get variables both from the HRS for the US and ELSA for England. We're going to make sure we've listed those file locations, and we're going to make a cart out of those variables. And then we're going to have the gateway generate a Stata program for us. And Stata is currently the only package that we use. I know people often use also SPSS and SAS, and currently we just integrate with Stata. So the result is one data set with information from 2 studies without any other extraneous variables. So let's look at how to do this. So let's use our concordance because we're looking for 2 surveys, so it's easier just to do a search. So let's search for health limits paid work. So that's our question. And we're looking in the US and England, so we'll select HRS and ELSA. And we were interested in the year 2006, so we can search. You see we get a list of search terms here. And so we can add any of these to our cart. Now that we have, now that we're logged in, we have a couple more columns here. One is in cart and one is status. The status indicates whether I have the location stored for this data in my on my profile and my data options page already. It looks like I do for both of these surveys, so that's great. If you didn't, if you had a little X there, you could just click on that and then add the dataset location to make sure you have the data. It's a good way to also check that you're always looking at data that you already have. And so we've got a couple of variables here, so we can add any of these to our cart just by clicking this add in cart button. Now you can see here we've got one item in our cart. So let's take it's this variable that I'm interested in, which is HELWK from ELSA 2006, and this question here KM0002 from the HRS. So I've added both of those to my cart. And now if I go look at my cart, let's say view cart, I've got just these 2 items in my cart. So that's great. You can also always save a cart. So you could select all and save, and we could just call this HRS ELSA working for, this is health limits paid work, right? Health limits paid work. So we can save that cart. You can see here it's added to my list of saved carts for this profile, and that's helpful if, let's say I'm going to use something else later on, but I want to save this cart. These variables seem important. It's a good way out of all these variables to kind of add some organization. I've also got some saved carts here, which we can load into this cart using an append. So I've got some ELSA 2006 basic demographics. Let's add that in. So this gives me, this is a previously made cart that I've used. So we get a gender and a year of birth variable. So let's say I wanted to look about something which was gendered, or maybe there was a cohort effect happening with whether health limits paid work, which or an age effect. You could look at that, and we also have HRS 2006 basic demographics. So we'll add that into our cart. So now that I've got all of those, we can, let's see, we're viewing our cart right now. So we could select all. We can make sure I've got checks here for all of those, and we can create a do file. And I can run this, I can open this directly with Stata. A do file, if you're not familiar, is it's the .do is the extension on a Stata program. But let's just open this with WordPad so that you can see it, see what is generated. So that's what's generated is a Stata code. I'll zoom in here for you. So first we tell Stata to use our ELSA data, and this is that ELSA 2006 data, and you can see it's got the correct data location for my computer, which is nice. I don't have to edit it. It keeps those variables which we want. It then adds in the HRS data, keeps those variables which we want, and it looks like we use 2 different HRS data sets here. And so it knows where those are, it knows what the names of those files are, and it pulls them out. And then the result is going to be one data set that looks like this. So on the top left here, we've got our HRS data, and we've got our ELSA data below, and so we've got everything in one data set, and you can start to do cross-country analysis, which is quite interesting. You can see there's also still a few differences. So we've got our variable KM002, which we've got 1s and 5s here. That was that whether health limits paid work for the HRS, and then HELWK. We've got value labels applied, so we've got some no's and yeses here. And so the variables aren't named the same, and I'm not really sure yet what the variable values are for the ELSA data, and whether they use a 1 and 5 for a yes and no, or a 0 and a 1. So this kind of gets us to our harmonized data, where we try to answer this kind of last set of questions. So harmonized data sets are provided, are created to provide harmonized measures of international aging and retirement studies. We built them to be as comparable and as similar as to the RAND HRS. So the RAND HRS is this version of the HRS data, which is produced by the RAND Corporation and has been since '92, which is very, very user-friendly. And it's the primary way that people use HRS data. And so the RAND HRS is structured in FAT format, as well as all of our harmonized data files. So in each data set, every record is going to be an individual. It uses a really simple variable names, which indicate more information about the variable. So a variable like R1 work is whether the respondent, that's the R, is currently working work in wave 1. All harmonized variables are, if they're exactly the same, they're named exactly the same as their NHRS definition. If the question is a little bit different, if it's too different to be exactly comparable, we'll use the RAND-HRS version of the name, but we'll put an underscore. For instance, if we're using share, we'll say underscore S to say that, hey, it captures the same information, but in a way that you want to be aware of there's some differences which are share specific. So we'll do an underscore S there. And then we also include spouse versions. So if you want to look at a family effect, also all of the values for the spouse are right there in the same record as the respondent. And those use a variable name like S2 work. So whether the respondent spouse is currently working in wave 2. So the harmonized data files that we currently have available are the harmonized ELSA, which incorporates the first 5 waves of ELSA, 2002, 2004, 2006, 2008, and 2010. The harmonized share, which incorporates the first, second, and fourth wave of share. The harmonized JSTAR, which incorporates the first 3 waves of JSTAR, 2007 to 2011. The harmonized CLOSA, which incorporates the first 4 waves of CLOSA. The harmonized LASSI, if you were interested in looking at the pilot data of LASSI. The harmonized CHARLES, so for China, is the first 2 waves of CHARLES, 2010 and 2012. And we're also currently in the process of adding the harmonized MHAS for Mexico, harmonized CRELOS for Costa Rica, and harmonized TILDA for Ireland. We are always updating all of these data sets to make them better. If we find any mistakes, we re-release them, and then every time a new wave of data comes out, we incorporate that data into these. And harmonized data files are distributed either by us or by the originating study. So in the case of ELSA, you actually just, once you download ELSA data, you're provided a file which is called the harmonized ELSA. It looks like I've got a question here. Can you talk a little bit about survey weights across different data sets? So all of these harmonized data sets do include survey weights. We don't, in the harmonized data sets, we don't generate our own weight, but every survey has weights included. And we do document in the harmonized codebooks how they determine their weights, which can be important for what you're trying to do. And I'll show you a little bit about that documentation. And sometimes that's a really great place to look to see how a weight was defined and for instance, whether the survey offers longitudinal weights or just cross-sectional weights, things like that. So to download any of the harmonized data files or to find links to them, again, you'll use this download tab. So we will link you to the place to download it. We also, for all of them, we provide the Stata code to download them, the Stata code that creates them. And that's especially helpful for a survey like Share, which actually doesn't distribute the harmonized share for us. So, but if you have the share data, you can just download the Stata package, and we give you some basic instructions here. You just need to edit a couple photo locations, and then you can run the harmonized Stata creation code directly on your computer. And that's quite easy to create, and once you run it once, you don't have to run it again. The Stata code is also nice because it allows you to see any changes, anything that we've done. If you want to see how we did that in Stata, if you're familiar with Stata, that can be quite helpful. And then we also provide all of the code books. So I'm going to walk through an example of simple harmonization, and then I'll just briefly just show you an example of complex one. So some of the things that we're doing when we harmonize. So one of the things that we do is we account for skip pattern. So say we want to make a variable called R1 smoking. We want to create a variable which indicates whether the respondent smokes now in wave 1 of share. So you see we have this skip pattern for share 2004, that's their wave 1, which is ever smoke daily. And then if you say yes, you could ask smoke at the present time. And we want to make an indicator whether you smoke at the present time. So we're going to account for this skip pattern already. So anyone who said that they'd never smoked or they don't smoke at the present time is assigned a 0 for smokes now. And if they say they are currently smoking, then they are assigned a yes. To that question. A 0 in our harmonized data sets, for all of them, a 0 is or a no is always a 0, and a yes is always stored as a 1. So these are kind of things that are always comparable. This is a very simple skip pattern. We also have skip patterns which are much more complicated, and skip patterns that change between different waves. So for instance, maybe there's a question that was asked in the first wave, and then based on how you answered that, when the interviewer comes back in the next 2 years, your interview might be different a little bit. And so we also account for those cross-wave skip patterns. Here's a very complex example of skip pattern analysis, which is taken care of. And this is for the harmonized JSTAR. And this is to create a household asset savings. So if you want to know the value of savings accounts or checking accounts in Japan, you can see there's kind of a complex set of skip patterns which are dependent on whether you answered their self-completion survey. So JSTAR uses first a self-completion survey, which is mailed to the respondent, and then an interviewer comes to your house later, and based on how you answered the self-completion survey, then determines how you're asked the regular survey. So we go through and assign all of this. You can notice this is also household level. So we've combined the respondent and the spouse values here. This H indicates household. Then you can also see we've got this bracket and this dotted line, and this is the unfolding brackets that are used here. And so if the person gets to the point where they say, well, I have a savings account and I don't know how much I have in it, then the interviewer says, okay, well, do you have more or less than a blank amount of yen? And the interviewer gets to decide, so more or less than 10,000 yen. And if the person says more, then the interviewer can say, okay, well, do you have more or less than 20,000 yen? And the idea is you can get a range, because we have a lot of missings in financial data. So you can get a range of what will be acceptable values. And then we actually, for the harmonized JSTAR, we provide imputations. So an imputation is when you assign a value to a value that is missing in a way that you think will not bias your analysis, but it will allow you to keep a respondent still in your data. Because for any of this missing data, if you don't assign a value, this person will drop out of your analysis. And what we know is that the people who don't provide values are generally people on the right end of the distribution. So these are people who, for instance, maybe have multiple savings accounts or have a lot of money in their savings account. And so if we want to continue to produce estimates which are representative of the population, we need to make sure that we're still accounting for those people in our analysis, and we can do that by imputations. So imputed values are provided in almost all of the harmonized data sets. And this is just to design a measure of the checking and savings wealth for Japan. You can see it's quite complicated. If you're not an economist, though, perhaps you're not interested in the amount someone has in checking and savings versus the amount that they have in their house versus the amount they have in pensions. You might just want total wealth. Say you're interested in looking at something like volunteerism, and you just think, well, people at different levels of wealth, might have different availability to volunteer as opposed to do household work or something like that, right? So you might just want a total wealth value for each household. So this is really months and months of programming work by professional programmers. And so the idea is we have a team of programmers here and a team of economists. And so, we've gone through all of these kind of things, and we've created a total wealth profile for you so that you can use it and you can really focus on the parts of your research that are most interesting to you. And for all the things that we do, we provide lots of documentation. We believe documentation is extremely important. So each harmonized data set is accompanied by its own codebook. The codebook includes a brief overview of statistics for each variable. It details the variable creation and any assumptions made in that creation. We highlight any differences between the harmonized variable and other harmonized variables. And we list all the variables from the originating data set that were used in the creation. And this can be important if you kind of disagree with how we made the variable. Let's say you wanted to design it in a different way. We give you the name of each of the variables in the original data to be able to make that variable your same way. So this is an example. This is from the Harmonized Share codebook. So you can see here we have this ever smoked. We have two variables here, which is ever smoked and smokes now. We have a respondent level and the spouse level. These are categorical variables. We provide some brief descriptive statistics that get you an idea of how the values are distributed. These are not population statistics because they're not weighted. So just keep that in mind. And then we also include frequencies because it's a categorical variable. So we have values always. A no is stored as a 0, a yes is stored as a 1. And then we also assign special missing values that are available in Stata and SAS. So anyone who said that they refuse to answer is assigned a .r, which is a kind of missing inside of Stata and SAS, but it is a missing that gives you some more information that's specific about what kind of missing that it is. You can see that we here have a lot of text here about how this was constructed. So what was the skip pattern that was asked? How are they coded? We also highlight any crosswave differences. So if the question changed in different waves of share, we'll let you know that. And then we have differences with the RAND-HRS. And we use the RAND-HRS as kind of our basis for comparison. So here we say, in share, respondents are asked whether they've ever smoked daily for a period of at least 1 year. And in the HRS, respondents are asked whether they've ever smoked daily, regardless of whether the smoking was daily and not given a definitive period. So depending on what you're trying to capture, this difference could be really important or it could be not that significant. But we always try to detail for you any differences so that you can compare between different surveys. And then lastly, we list all the share variables used. And this here is an example from the codebook, and I'll just run through this. But this is for the harmonized share, that second example of harmonization, which was much more complicated. You can also see that we create a flag for all financial variables, which lets you know whether it was imputed or not. So you can see here a value of 1 is a continuous value, which means it was reported. A value of 6 means that the person said they didn't have an asset, so they were assigned a 0 value. So we're accounting for a skip pattern there. And then it can be, they were assigned a value in the imputation process based on a complete bracket. So in the case like such, say that we knew it was between 10,000 and 20,000 yen. An incomplete bracket where say we knew it was, greater than 40,000 yen, but that's all we know, or there was no bracket. And then JSTAR also provides top coded values. So we let you know whether it was a top coded value. I've got one more question here, which is, can you talk a little bit about the naming conventions for variables in the harmonized data sets and how it compares to the RAND-HRS naming conventions? Absolutely. So in the, we try to always use the same name if possible. So for instance, a question, a set of variables like smoke ev and smoke in, which is these are exactly the same variable name in the RAND-HRS as they are here in the harmonized share, because the questions are exactly comparable. So we always follow the same. If it has a different variable name, like say we have variables, of course, which aren't captured in the RAND-HRS, so we assign a different variable name, but in a way that still uses the kind of same naming convention. So the first letter always indicates the level, whether respondent, spouse, or household. The second character, which is a number, indicates which wave it was taken in, and then the rest of it is what we call a variable name string. We try to capture that. I also had a question of what is a top coded value. So in a couple of the data sets where they are concerned about identifying people, and especially people at the high end. So let's say there was someone in the JSTAR survey And you would be able to know, for instance, which part of the country they lived in. You already have their age and their gender and let's say their birth month or something. And then you might know that, oh, they have, 40 million yen in household wealth. It could be maybe quite easy to find the people who have houses, to actually identify people. And so this is something that people who release data often worry about. And so one of the ways to avoid identifying an individual is to top code a value. And this isn't done in all surveys, but it is done in JSTAR. So for a certain select number of people, you can see here in wave 1 it was 93 people, 10 people in wave 2, and 20 people in wave 3. They didn't provide the actual value. They provide just kind of a maximum value, and they don't go above that. So really, you can still leave these people in your analysis. You just want to make sure that that you're kind of aware that there's some top coded values, and you might not be able to say anything very descriptive about people at the very top end. And again, top coded values are they're not included in the HRS. They're not included in ELSA, but they are included, especially for smaller countries like Japan, where they would worry about identifying people. They are included, and we'd let you know about that. So also, again, in the code books, your questions about weight. So we would have information about exactly how those weights were defined. I got a question here from Hu Jing. Should the spouse sample be treated differently from the main respondents in the analysis? So for most surveys, both the respondent and the spouse are interviewed. If you click at the surveys at a glance tab in the study overview, you can see one of our questions here is spouse inclusion. So you can see that in almost all of the surveys, the spouse and the respondent are interviewed, so you don't have to treat them differently. Except if perhaps the spouse sample is of a different age, so that can be important to remember. So you might have someone who is 60 in the survey, but who is married to someone who is, say, 30, right? So you might want to remove spouses from your analysis if you're trying to say something about people of a certain age. And I will say usually for the weights, those younger spouses are given a 0 weight. So if you're weighting your analysis, the spouses will be dropped out, and there's nothing you have to do there. Also in the case of JSTAR, spouses were not interviewed. The respondent was asked questions about their spouse. So I do think that it's probably important with JSTAR for those spouse values to to know that it's not a self-report as it is for a respondent. He also asked the question, the sample weight takes care of sampling probabilities of the spouse as well. Yes, so for all extensive purposes, the spouses are considered just another respondent, but 2 respondents are coupled together as spouses. So they each have a different weight. So you don't have to treat, there's not necessarily a respondent sample and a spouse sample, but you are able to look at basically the values of the respondent who is that person's spouse also, if you want to look at something at a household level. So I hope that is clear. And the last thing that I will briefly, I'll briefly show you, I won't go through this because we're running a little late on time and I want to be respectful of people's time here, is so say if we wanted to update our example where we want to compare whether health limits paid work in the 2006 between the US and England, we could select variables from the REN HRS and the Harmonized ELSA, these harmonized data sets, and the variables will have a similar naming convention. We can download and run our generated do file, and the result is going to be one data set with variables which are exactly comparable and similarly named. And in this case, we've used an R06 name, so respondent level 2006 health limits work, and everything has the exact same value here. So it's quite easy to go ahead and start to do your analysis using any weights. We've kind of, one of the things that we want to do is take out a lot of these data steps for you. And then briefly, just to wrap up, I'll show you our literature search, which is our newest feature. So you can find publications based on health and retirement surveys around the world, which are relevant to your research focus. So you can select from survey topic or year, search by title, author, or source. So this is our last tab, which is publications based on surveys. So as this loads, we allow you to select from a lot of different surveys. We kind of constantly go through a publications list and try to find publications that use data based on these surveys, and we pair. So it's having a little trouble loading. Hopefully we'll get it to load here. We'll pair. One of the things we do is we assign topics and the data sets that were used to the surveys themselves, which can be quite helpful if you're doing a literature review. I'll give this one more shot. I'll let you know. So you can, all results are linked to Google Scholar. So for instance, if you're interested in obtaining that piece of analysis, you can use Google Scholar. And then in the case that we actually can provide a direct link to that paper, we provide the direct link. And then you can make citation lists, and you can download those in text, CSV, or in Node file. And it looks like there could be a lot of people using this site right now, and maybe it's a little slow. I'm having trouble loading that. So since we're running out of time, I'll just skip that. But I encourage you definitely use the publications. We've gotten a lot of great feedback from users about that so far. Oh, there it goes. Let's jump back. Maybe it'll go to it, and I can briefly show it to you. I'll also tell you, so we have a help desk. So you can email us at any time. Our email address is help@g2aging.org. So here's that publication search. So we allow you to search, let's say you're interested in people who, other papers which were published using MHAS data, so that Mexico data, and then you could say Mexico data, which was looking at income, if that's what you're interested in looking at also. You can see that we have a bunch of papers here, and you can click in. We have in this case, we have a direct link and a Google Scholar link. And you can also search by author, which can be helpful also. This is Eileen Crimmins, who is here at the University of Southern California, who publishes quite a bit on these. And then for any of these, as I mentioned, if you select multiple ones, at the bottom here, you can export. So here's our help page. If you have any questions about how help, how the website works, getting registered, finding access to these data, please let us know. Also, if you have questions, say you're interested in a topic and you're not sure whether surveys cover it, you're welcome to email us. We always try to answer back within 24 hours. So we have a a small team, but we always try to answer back within 24 hours the answer to your help. So you can email us at help@g2aging.org. So that will be, this is kind of the last, this is the end of the webinar. I'll also let you know that we'd love for you to fill out a survey if you enjoyed the webinar, or if you didn't, if you have feedback, and that will get mailed to you after the webinar. You'll get an email tomorrow asking you to fill that out. So I really thank you guys for joining us. If you have any questions, I'll hang out here in the chat and in the questions. Please let me know if you have any questions or you'd like any more information. We really hope that this webinar has been helpful for you to kind of get your idea of all of the data that are out there and all the research opportunities and some ways to understand these complex surveys that are asked in different countries. Thank you.